On a more narrow look at the North America area, how do we just expand in that area, in that component, in that environment? When you deal with therapy or real-time, live engagement, when you talk about AI and technology side of things, of course, but that's almost fair game, right? If there's a good technology out there that people can benefit, we can discuss, maybe go into RPM, remote patient monitoring, or other areas like that, and that can really cross state lines with a little bit more ease, or across national or across oceans, to be able to support and benefit the member.
Greetings, everyone. This is Arvind Sarin, your host and the CEO and chairman of Copper Digital. And you're tuned into another captivating episode of Health Tech Innovation 2024-25. Today, we've got a guest whose professional journey is like a gripping novel with chapters in executive sales, corporate operations, and human capital management. He's a visionary behind explosive growth of Great Speech Inc., a company revolutionizing virtual speech therapy in 47 states. Our guest's passion for transforming healthcare through technology was forged in the crucible of real-life heroism. He was a first responder to the One World Trade Center on that fateful day, September 11, 2001. Today, as the Chief Revenue Officer at Great Speech, he's not just breaking barriers, he's redefining how we approach healthcare communication. Without further suspense, let me unveil our guest, the mastermind behind Great Speech, Drew Ben-Aharon. Welcome to the show, Drew.
Thank you very much. Thank you very much, Arvind.
Awesome.
I'm excited to be here.
Well, thank you. So, Drew, your journey from being a first responder on September 11 to becoming a key player in telehealth is truly inspiring. Can you share a pivotal moment or realization as you were going through that, and what led you to get into the healthcare industry and specifically in telehealth?
Yeah, absolutely. So people always ask me, how do I attach the two together? It's a little bit about my own personality, a thrill seeker, a little bit of an adventure seeker as well. Being a EMT in New York City for 13 years, I found myself in different conditions and serious scenarios. Of course, September 11th was the greatest, or most dangerous event that I've experienced till today. With that, as an entrepreneur, right, we're risk-taking. We have to really know ourselves and take those, leaps. And, what I say is really calculated risks and figuring out what the next steps would be to be successful. If you're in a serious medical condition and you're in a rescue event, that you need to think about that. And if you're steering a company into the unknown, and I say that because telehealth is somewhat its infantile stage growing, and where we are today is nowhere where we were 5 years ago. And I'm excited to see where we're going to be in 5 years from now in regards to telehealth.
Wonderful. Okay, great. Well, so then in 2001, when that happened, how long after that did you actually transition to getting into the healthcare industry?
Well, it took a few years to get into the healthcare space at that time. I was actually, the reason I was a first responder, I got there so quickly, is I was actually a trader on Wall Street at the time. But I also, quickly kind of understood that, the greatest growth is going to happen in the healthcare space. So when I looked to transition out of Wall Street, healthcare was just the, natural growth or natural movement that I made it, and I moved to.
Got it. Yeah, no, healthcare is just such an important industry, even for us here at Copper Digital. And, that's because of the need. There's just so much that's needed, and health is one of the most important things for everybody. And I think it's just so unique as an industry, and the technology can definitely help us give that much better experience for all of the patients, and really amazing outcomes. So
Right.
You've been an instrumental designer for Great Speech since its inception. When did you guys get started?
So in 2009, I started at ND Live, and in 2014, I came to my wife and I said to her, "Hey, this telehealth thing is really going to be hot. It's going to be interesting. More interesting than not, right? Everything kind of happens for a reason. She looks at me and she says, you wouldn't believe it. She was actually a speech therapist in a clinic, and she was telling me about a mother that had 3 of her kids show up to the clinic. One was getting speech therapy. Another one was doing their homework in the waiting room. And the third child was being fed dinner while they were going to it. And the mother was frustrated beyond belief in regards to having to, pull all these things into play to be able to make sure that her child that does need help receives the help. And she looks at me and she says, why can't we do this through a telehealth solution? Why can't we build that out? So in 2014, we literally launched the virtual speech therapy. I'll tell you that there was nobody out there that we found, that we were aware of, that was involved in that space. And we're reinventing the wheel and making sure that we provide good protocols, we follow through with it, and kind of build it out. We also had to find a team, because there was no EMR, there was no platform that services speech therapists or any therapy at that time. So we went out there, we hired and bootstrapped our own, developers to build it out and create a platform, which today is incredible. We sometimes really just take a step back and are amazed at the level of complexity that it has for the patient, as well as for the therapist side of things, right? We have to think about both sides as we grow through that. So, it's been fun. And of course, COVID really propelled us. We were in the right place at the right time.
For the audience, can you describe a little bit, like, what does Great Speech do?
Absolutely. Great question. Thank you. So we're a virtual speech therapy company. We support kids, adults, and seniors in 47 states today. One of the things people think of as speech therapy is just about little Susie with a lisp or Stephen with a stutter. But I need, to kind of think a lot broader. If you look at traumatic brain injury patients, concussions, if you think of brain cancer, brain tumors, mouth cancer, tongue cancer, people have to relearn words. Post-stroke patients, aphasia, we support. There's also tremendous research, and one of the biggest gaps I feel in healthcare today, when it comes to speech therapy, is a cognitive deficit. There is research and proven white paper that shows that speech therapists can help slow down the cognitive impairment. Now, I'll make sure to say to you, I'm not curing Alzheimer's, I'm not curing dementia, but there is a component to slow it down. And what does it mean to you as a family member if your mother or father can remember words longer, can remember events longer, and have that? We don't see that enough in the care plan today, the cognitive deficit areas, but we also work with the autism population. And most recently in 2023, we launched a transgender voice affirmation. So those that are transitioning can therefore connect their voices to the actual, gender that they're specifically looking to be, and work.
Wow. Oh, that's amazing. Yeah, it looks like you guys are helping a lot of people. That's great. So for the audience, I guess you're like the BetterHelp for speech therapy. BetterHelp, does therapy. Right. Of course, lots of people are very familiar with that. So the way that you do this therapy is through an online meeting, like a Zoom meeting, or is it through your platform? And then that's when the patient would join in and have that exact same, type of experience that they would if they were to go to like an actual therapy.
So our favorite part is our hybrid model, where we have synchronous live one-on-one therapy with the speech therapist. And it is just like you said, think of it like a Zoom or what we're doing right now to integrate and interact. And then we have an asynchronous, component to it, where the therapist provides homework to the patient, depending on what their ailment or their issue is, and we walk them through a care plan, right? There's always, we're looking for them to, progress through the process, follow the care plan, and get to a certain level where they can graduate from our program. So the synchronous and asynchronous to live one-on-one therapy, along with the hybrid homework that we created, some of it, or a lot of it, is video tutorials for them to train and practice on. is really what's working well, and we're seeing, good success on that. And yeah, by the way, great way or great comparison, BetterHelp in the mental health part of things is a good comparison to what we are in the speech therapy realm.
Got it. And then, so if there is a patient, like usually, is it covered by the healthcare insurance, or are you working with them directly, or is it direct connection with the patients, or are you getting a lot of referrals? I'm just trying to understand the landscape a little bit, just for my
No,
curiosity.
absolutely. No, the number one reason patients don't seek care today from us is financial. So we're looking to get signed up with as many insurance companies out there as possible. Some of the big ones have already signed up with us, like Cigna on a national level. We support the commercial and Medicare business. We have most recently Centene, which is the WellCares and the Sunshines and the Ambetter that we have.
So is this signing up, sorry to interject, but is this signing up more for telehealth? Like they would allow or approve therapy in person, but they're not allowing remote therapy. Is that the case?
Well, some of them have their network closed. You can't even sign up with them. They're not looking to add any speech therapy at all. Others don't want to approve a telehealth product. Some are nervous that it might create utilization, right? Which you're absolutely right. It might create utilization because utilization is needed and can't be accessed. One of my favorite stories is a Texas patient we have. There's about 80 people in his town, and he can only access speech therapy virtually on days that are sunny because his internet is satellite-based. That's how remote he is. If it wasn't for our availability and our capability, they would not get the care they need. He's actually a post-stroke patient, right? So then imagine, what does that mean to a aphasia post-stroke patient not getting care and not being able to communicate? We talk about social determinants of health. Well, we know it's going to get them to self-isolate. You can't communicate. You're not calling your friends and your family members to hang out. We know that's going to drive them to loneliness, right? We know that's going to be a driver to depression. Well, depression is going to be handled by their primary care, and they're going to give some medication or pharmaceutical component. And I tell insurance companies, look upstream. Look to see what created the ailment or issue, what created the loneliness, what created that social determinants of health that we are speaking so much about, and is the ability to communicate a key factor for that patient or for that support.
No, I like that. And I like that link as well, because yesterday I had a podcast with Jeremy Holloway, who's made some significant impact in this specific field on preventing isolation for senior citizens by connecting them with students. So he's got a great product, Telegacy, and for the audience, if you'd like to check out that podcast, definitely do. It's something very similar that we talk about. But I do agree that I think it's enabling people to have those great conversations where they feel heard and they have that confidence, so that they are not isolated. So you're absolutely right. That's going to lead to isolation if they are not comfortable, confident in speech. So no, that's a great cause. So kudos to what you do and the mission that you're on. Now, at Great Speech,
I was saying, do you think of communication as the top of the pyramid? You and I could both be diabetic and still have it be working and doing this podcast together. You and I could have a musculoskeletal or back pain and still be working and communicating and doing what we're doing right this second. If either one of us had a communication disorder of any kind, we would not be able to function or work our usual jobs. We would be out of work and going through it. So communication is really at the top of the pyramid. And we learned that with COVID, when people seek that social connection, right? And that social connection is about communicating with one another. So it really needs to be looked at a lot more serious than health plans are seeing it as.
Absolutely. I feel like even as a species, we evolved and made a huge dent on the planet, if you will. I mean, we kind of rule the planet as Homo sapiens. And I think what was different was our ability to tell stories. There's this really awesome book by Yuval Noah Harari. You're probably familiar with him, but he's written this book, Sapiens, and he talks about how we flourished because of our ability to tell complex stories and then have those stories stay and then be communicated further to people. And that links perfectly to, ability to communicate. And I think you guys are definitely doing a great job. So I guess
Thank you.
switching gears there, so when you started Great Speech, or, since its inception, what were some of the early challenges that companies faced?
Well, some of these challenges are still existing, and we'll talk about that in a moment. But really, the adaptation, right? The credibility of the product in 2014, 15, 16, right? People didn't think of telehealth. People didn't think of accessing care on a virtual model. So it really was educating the members. And by the way, that's happening today. I meet with, top executives having aha moment when they think about virtual speech therapy and tell me they've never heard about it. And these are at the top of their game. So it's really about education and support in that component. One of the biggest barriers is licensing, right? Today, as we talked about, each one of our speech therapists has to be licensed in that specific state that the patient's in. Why is that, right? Why do we have that? Why aren't we creating some kind of national telehealth license that says, pay this fee, have that, and you can support speech therapists. And by the way, that goes to a lot of different fields to go out there. And those speech therapists will be able to practice in each state. So I don't need to each and every time apply to a specific state and have that. And it really hinders the success, because one of the things that's really nice about virtual is our subspecialty. A speech therapist comes out of school and she's supposed to know everything and anything about all ailments and issues. But realistically, they then go into subspecialties. Some will go only into adults. They will deal with more cognitive or post-stroke patients or things. Some will go into more pediatric. We'll deal with articulation or stuttering in that area. Well, what's nice about our profile and how we look at our therapists is that we do categorize them like that. So our therapists that work with adults, only with adults. And our therapists who work with kids, only work with kids. And if you're a stutterer, then we have therapists, that are specializing, that done extra, training or schooling or stuttering specifically. Now, why shouldn't you be getting that best therapist to support you in that area? Today, hopefully that therapist is licensed in the state you're in, and if not, then she can't help you, and we get somebody else to support that also has, more knowledge about that ailment or issue. But we want to go with the best therapists out there. And the licensing is definitely something that's holding us back today. And I think that if we can really reevaluate it, and there's a lot of talks about reciprocity and more of a telehealth license, and some states are going to accept it and some states are going to reject it. But we need to move quicker on that. It's going to help a lot to the members.
Yeah, no, that's an important point that you raised. So I guess, is this the same for other fields? And I think it is, but it applies to them. Like, as an attorney, you have to be, on the Texas State Bar to practice here. But that's logical because there are the state laws and the courthouses here. Similarly, for somebody to work on HVAC, they have to be licensed, or, an electrician, they have to be licensed in that state because it's actual work. But I feel like, with the telehealth now, this is something that needs to be evaluated. Do we actually need, or can we have, like you described earlier in our conversations, this one license that covers all of the U.S.?
I remember when COVID did it, there was a, everything's open. The first,
Oh, really?
I don't want to be quoted, was it a year or 9 months and get misquoted? There was a time period that the federal government, the states said, hey, it's open to everybody. You don't need to be licensed to practice in our state. That got shut down a year plus or so. But again, don't hold me on that time frame. So it did happen during COVID. But then they reverted back to now you need to follow each license in each state specific. When it comes to the healthcare space, you're absolutely right. Attorneys have to know specific, laws or different events that took place in that state. In the medical field and speech therapy, a child that stutters in Florida, I'm not saying every child is the same, right? Every kid, every person, every patient is different, but has the same characteristic as a person stuttering in Washington State or in Alaska. And let's treat them and support them with the best therapists that we have.
Absolutely, absolutely. So your work mainly is on some sort of a disability that happens, but is it also available for, let's say, um, people in different countries who want to improve their communication as such? Like, I'll give you an example. When I graduated, then because I was born in New Delhi, India, and I came here at a young age, but then the English that's spoken in India is, of course, very, very different. So I had to really just, understand certain things. And there were elements like, hey, say this in a certain way. Like for Indians, like v and w is the same sound. Like we can't even decipher. So we might say, oh, I'm very good. But, that's very, which I understood, like how you got to like roll the tongue. So, I mean, there are a lot of that science-based methods to sound a little bit more convincing or be understood. I think all of those same motivations, but is it a different field? Because I know there are some instructors even on YouTube or people running their practices for CEOs of multinational companies, but that's not something that you dabble in. And do you look at that as something that you could expand to in future?
So what you're speaking of is, especially what you brought up, is called accent modification. And we
Yes.
absolutely do that.
Okay.
We have a lot of South Americans that come to the US and are looking to sound more American or pronounced differently. And we do partake in that. And, that's not insurance based, by the way. Insurance won't cover it, but we have a cash paying direct to consumer program to help those that are looking to sound more American. In regards to a global level, we're back to licensing. We're back to, needing to create some kind of reciprocity. We're today licensed state by state, our therapists, and a person in Jamaica, right, who speaks English, that needs our services cannot be supported by us. We cannot help them in a different country or in a different state. We would love to see that expansion. We could talk globally, but I'm saying even just look North America, right? We
Right.
could talk about Canada. We
No,
could
but
talk about
what's the reason?
Mexico.
What's the reason that somebody in Jamaica, like, is it blocked by their healthcare system or insurance, or is it blocked by the United States?
Well, it's really licensing. We're not licensed to practice in Jamaica, right? You're licensed on a state by state level. Some countries have specific guidelines to it, and some don't. But again, you would need to be licensed. Now, I speak about Jamaica because specifically we get a lot of inquiries from Jamaica. They don't have that many speech therapists. It's not about even rural or remote or anything. You could be in the most urban area and they have only 2 speech therapists and they're booked for 10 months or a year. And people are Googling and finding about our company. But regretfully, we can't support that today. Again, going back to licensing and just opening it up to being able to help more people.
Yeah, and I think that's an important aspect that I'm sure would get attention. And by us speaking about it, I'm sure that somebody watching who can have an impact could take it up and see how to make it more accessible and easier. And I'm glad you touched on a little bit on beyond the U.S., right? Because there is so much of potential benefit through collaboration in overall health tech space. I mean, there are these international partnerships that can contribute to advancing healthcare on a global scale by sharing knowledge. I mean, I spent a lot of time in India last year, and that's when I discovered that even in India, there was BetterHelp version, and it was good, but I didn't connect with the therapist as such because of the culture and all of that. So, that didn't work. But I think that's something that should be possible, like globally, making telehealth available. What are some of the partnerships that you see would be most beneficial?
Right. One of the concerns I think the U.S. has, I can't speak for other countries, is quality, right? Our speech therapists that graduate here in the United States, right? We know the level of the university. Then we have ASHA, American Speech and Hearing Association, that is our governing body, that you need to be in good, good standings with them, and they verify it. And then we have are, CEUs, continuing education credits that the therapists need to, get on a regular basis. So I think I can't speak about why we can't go out, right? Because I feel like we're at a very high level, but I can see that maybe the concern is, well, if I let them practice outside of the country, then I need to say that those therapists or those doctors can practice in our country without that licensing or without reciprocity. And the concern is what level of training, education, and quality we might be bringing in to those patients. And,
I like
how
that.
do we
Yeah.
lose that quality control? How do we lose that quality assurance aspect to it? So I think that's where the big concern is. That's where the big picture we need to kind of evaluate. Because number one and most important is quality, right? Over anything else out there. Like you said, we could talk about where we're going um, on a global level, but I'm saying, on a more narrow, look at the North America area. How do we just expand in that area, in that component, in that environment? When you deal with therapy or real time, live engagement, when you talk about AI and technology side of things, of course, I'm not an expert, right? But that's almost fair game, right? If there's a good technology out there that people can benefit, we can discuss, maybe go into RPM, remote patient monitoring, or other areas like that. And that can really cross state lines with a little bit more ease, or across national or across oceans to be able to support and benefit the member. So I was speaking only on the real engagement or live engagement that takes place between the member and their caregiver, patient, doctor, therapist, or anything else.
Yeah. And so that's interesting what you mentioned, because it just brings some thoughts. Like, couldn't there be an avatar who is programmed using AI that could just know on the basis of, okay, well, these are the first few questions, and then you hear the patient, you analyze it, you give them instructions. I mean, maybe not everything can be done, but there could be at least some prep sessions, or to make it globally available. Wouldn't everyone benefit? Like those people in Jamaica who only have two or very few therapists and there's no appointments, would they not benefit from an app like that where they could just download and be like, okay, well, I'm going to set it on a tripod and just try to do this? Or even for the accent modification, I think something that has analysis of the speech, from the person who's on the other side, but then that brains could be AI. And then there could be maybe one session every now and then with the therapist as well, or somebody could be reviewing in the back, like, are they getting the right instructions, or is there something more important that we're missing out? What do you think? Can technology help there? And if so, how far out are we from having, applications, programs like that?
So we're not that far out from there, but yes, it absolutely can help, and to be able to get to those members that might not get care as needed. Of course, you need to check regulations. I can't speak for, can you do a fully asynchronous product in countries outside of the U.S., and what would that look like? And what will those countries, how will they evaluate that technology? Or are you coming into their country? So I can't speak on that. But you can absolutely go into more of that AI, more of voice recognition, and being able to identify. There's currently going on in Europe specifically certain research being done. Can you identify cognitive impairments early on, 4 to 5 years before signs of the cognitive issues going on, through your speech, through your voice? It could be early onset of Parkinson's. It could be early onset of Alzheimer's dementia. And there is research taking place. And that's why I said to you originally, in 5 years from now, we're going to be in a whole different place. We are at that cusp. We are at that level.
We surely are. And things are moving so fast. The advancements in healthcare, it's just mind-boggling and really amazing. But let me ask you this. So what do you believe are the most pressing challenges that technology can help address in the coming years? And it could be across the board. And I guess once you mention those, talk about like, how can innovators contribute to solving these challenges? Because some of these, may not be ready now. So what do? You wait for it, or maybe you come up with an alternative and you slowly, like you mentioned, your iterative approach. It's something that I feel like you guys were in the market before that surge happened, right? And that's very important. But I think that's very hard to predict. So you probably just have to do whatever it is that you're passionate for, and then rising tide lifts all boats. And I think pandemic definitely helped a lot for this, telehealth industry, and of course many other industries also. It just helped, with that surge in demand, and also changing the perception a little bit.
Absolutely. Absolutely.
So what trends are you most looking forward to?
So I think the big focus is going to be about chronic care management, right? That's the costliest dollars for health plans, for healthcare, or for employers that are self-funded. How do we, how do we support those chronic conditions? How do we improve it? There's a lot of talk about, diabetes, right? RPM, remote patient monitoring. What can we do? Can we reverse diabetes? There's certain companies out there that are making that claim or showing that proof that they have the secret sauce for reversing that. How do we make sure a patient adheres to medication? Do we, carrot or the stick? Do we reward them for staying in line or following their care plan as needed? So again, a lot of it's going to be about the chronic condition management, the costlier dollars that are going on in healthcare, and to see how we can bring that down. How can we save money? How can we bend that trend? How can we really improve it? RPM in the technology side of things is going to be a big factor. I love my Apple Watch. It gives me so much data about how much I sleep and how much I exercise. And, while we were talking, it dinged me, telling me it's time to stand up and to move around. Those are small things that we're looking at, but we can look at much bigger things that go out there, right? If it's identifying, any kind of heart conditions or sugar level or anything else that might be going on, we'll be focusing on that a lot in the next, coming years.
Absolutely. I think it's going to be super fascinating. And I think there's so much now that's possible, especially with AI as well. It's just really amazing. Okay, well, good. I guess as Chief Revenue Officer in your role at Great Speech, I guess you're responsible for driving revenue growth. And that's an important aspect of your role. What are some of the strategies or initiatives that you found most helpful in achieving that sustainable revenue growth in the health tech sector?
So the big factor is educating, right? Being a pioneer, there's an old saying, pioneers get all the arrows and the settlers get all the land. And what does that mean? As a pioneer, I get arrows each and every day. You don't know what you don't know. And I tell that to people all the time. You don't know how big a problem it is until you start, digging deeper and delving deeper. If you look at just your current, claims for speech therapy, you might say it's a moot point. It's so little, it's not even worth, when you deal with billions and billions of dollars, that's not a line item that you're really focusing on. Well, how come? Is it really because it's not such a big deal? And 46 million Americans have a communication disorder that's not being addressed? Or is it that people can't access care? And I say that to health plans as they come on board. We had one health plan that gave me an estimate on what they're expecting for us to do in 2022. We broke that estimate by 841%. We then in 2023 broke it, and we doubled it by 202%. And why is that? They kind of scratched their head and looked and said, where is this coming from? Why didn't we see that? Well, it's pretty simple. If I am in rural Florida and my child needs speech therapy, and I know everything in my town, and I know that the closest speech therapist is only about 80 miles away, I'm not even bothering to look for care. I'm not even looking for the support. I'm not getting the care. I did a study in the state of Florida and found that north of Orlando, there was very little, and we use CPT codes to evaluate, very little speech going on. I'm not saying it's not happening at all. You have a little sporadic area, but south of Orlando, you saw a lot of speech therapy going on by the CPT codes. North of Orlando, you did it. Now, we can assume two things. Either we should all live north of Orlando because they're healthier, nobody's autistic, nobody has strokes, nobody has cognitive deficits, nobody has traumatic brain injuries, no articulation or stuttering issues, and we should all really move to somewhere north of Orlando. Or the next thing you need to look at is saying, maybe they have an access issue. Maybe that there is more remote area. Maybe the panhandle area of the state of Florida really doesn't have speech therapists. So even if I do have my mom had a stroke and speech therapy is a requirement for her, if I don't have it in my area, I'm not seeking that care and I'm not getting that care. And I think that's the biggest area I keep telling plans. I go, it's not about what you're seeing, it's what you don't see. If the CDC tells you there 37 million Americans that are diabetic, and the U.S. government is also saying 46 million Americans are suffering from a communication disorder. Where is that in the numbers? When you look at that. So I really try to get plans to educate and look at it in that regard. What percentage of and I can throw a lot of data on cognitive impairment and deficits and how speech therapy should be part of the care plan out there. And when I tell chief medical officers, I say, just run a report. How many diagnoses of Alzheimer's dementia also are getting a CBT code of speech therapy? The percentage is almost zero. They're not getting it. For whatever reason, you can talk about, we've spoken to neurologists, they tell us that, it's more pharmaceutical based. We talk about that the Alzheimer's Association doesn't even have speech therapy as a referral source on their page to go through it. So it's really about breaking barriers and educating people about the importance, and not about what they see, but about what they don't see that should give them that aha moment and realize that something needs to change.
Yeah, no, absolutely. I think I love it. Definitely there needs to be that adoption across, and I think starting with the insurance companies is really important, and educating the patients as well. So
right.
Technology adoption in healthcare can sometimes face resistance, as you're seeing as well. How do you address those potential hesitations or concerns from even customers? Like if somebody would have this perception that in-person therapy might be much better if they are not living in a remote area, if they have access to a lot of the speech therapists, or even otherwise just generally telehealth, and even going to your PCP. So how do you address those potential hesitations or concerns for the customers, and what communication strategies have proven effective in overcoming resistance to technology adoption in your experience?
So I would like to first make a disclaimer that telehealth is incredible, but isn't for everyone and everything, right? We can't solve for everything. There's always limitations. Telehealth does have limitations, and we need to work within those limits that are appropriate for each specialty or each support. With that being said, the conversations have changed dramatically pre-COVID and post-COVID. Pre-COVID, those hesitations were a lot stronger. Post-COVID, people are actually preferring the virtual. We are like Amazon Prime. Today, we want things instantaneous. I get annoyed when I put something in my Amazon cart, and when I first put it in, it says it'll get there by 10 p.m. Not that I need it by 10 p.m. But then when I check out, it also says tomorrow, and there's a little bit piece of me that's annoyed, even though it doesn't matter to me, it won't affect my life. I didn't need it at 10 a.m. So people want things to their front door, and that's what we really are. Who is my best customer? Who's my best, patient? It's the Amazon Prime subscriber. Is the person that's looking to get it to the door, wants convenience, doesn't want to have to trouble themselves, get into a car, get out of a car, find parking, weather-related storms, snowstorms, blizzards, or anything else like that. So those conversation pieces have really calmed down a lot. With that, I'm going to say also, even the urban areas are having limitations or long wait times. We just signed up with a new plan that we spoke to a specific state to their clinics, and they have a 9-month waiting period for speech therapy. They're ecstatic that we came on board, and this started January 1st, and we're already seeing large chunks of patients getting the pre-authorization and going into our evaluation setup and moving forward on that. So the conversation has changed. I would say there's less of a pushback to it and more of a, can you get it to my doorstep? Can you bring it to me rather than me having to go to it? Walmart today delivers, BJ delivers, and they want their speech therapy delivered to the home as well.
Yeah, absolutely. And I think not necessarily that in-person experience is going to be better because, like we were talking earlier as well, I think for certain population, it could be like a game, or it could be, they could have a lot more sessions. And then, of course, like you gave the example of a mom juggling with 3 kids, one in the session, one doing homework, and another one, also occupied. I think those are the scenarios, that are important to consider. But, like it's not necessarily that you're going to have the best experience in person is also true. So I think that's pretty important.
Yeah, I mean, the kids love it, right? You're telling me I can sit here and play with somebody for 30 minutes. Some of them don't even realize they're in therapy, right? We might be playing chutes and ladders with them, and we want to look for certain sounds that they make if it's an articulation, and they're engaged and are looking for it. We've had parents tell us that the kid fired their 2 therapists in person, and this was their last resort, and the kid's embracing it and loving it and appreciating it and wants more. They get upset when we graduate them and tell them, okay, great job, you've reached your goals. We now need to graduate, from the program, and the child's upset. He wants to continue, and we've had that feedback, which is actually interesting. We have
great
feedback from the seniors. We hear, we're so excited for a speech therapist appointment on Wednesday. The day before, I went to my hairdresser. I know what I'm going to wear. I'm looking forward to it, because what are we doing with seniors? We're getting to speak. We're getting to focus. We're interacting with them to go through it. They're looking at it and they're looking forward to it, right? So we're actually affecting SDOH and loneliness when it comes to those areas.
Absolutely. No, it's great. I guess moving on to 2024, 25, what are some of the emerging trends or developments that you are particularly really excited about that you think would capture the attention of the industry?
Well, in my space, I'm trying to focus a lot on the asynchronous. We built that hybrid model over COVID because we were really growing exponentially and wanted to be able to leverage technology to go through it. We're going to be looking to build more of that asynchronous, get into maybe AI type of discussions where you can speak, certain steps, and then there can be certain evaluation, correction time period, and kind of learnings through the process to go through that. That's in our world and what we're looking to focus on and investing in. As a whole, as we talked about, I think, the RPM space, or remote patient monitoring, and how do we really reward for good behavior is going to be a big factor for plans and for technology all across the board for the chronic conditions. That's where the big dollars are being spent, and that's where the big focus needs to be spent to be able to reduce that.
No, I love that. And I love that reward, approach as well, like carrot or stick, and the gamification aspect of it, and how our brain reacts to some of these things. I think linking that to the right behavior for the diabetics or other people where there can be that remote monitoring that could happen can be, obviously really, really important. I love it. Well,
so yeah, it's very funny you mentioned that, because we did build out this year gamification into our platform, and it really relates to your care plan, right? How many sessions you're following through, meeting your care plan, how many weeks have gone by without any cancellations that went on, and you get trophies and you get stars and you get rewards to go through that. And people do like that, even though, like I said, it's just that email, congrats, you went 3 weeks with your care plan following through. People don't want to lose that streak. They want to get that 4th week notice. So we have been finding that that's been helping, and we have been building into that as well.
And there are right and wrong ways of doing that, meaning not just like Audible also has a similar program, but I'm not so married to it. Like, fine, I got a badge, and I get all these other badges on, the Apple Watch as well. I mean, all those are fine, and I think there are some other apps that are similar as well in different regions that just, definitely leverage that, reward system in our brains, to help us out with that. Well, that's fantastic. Drew, thank you so much. I guess, unfortunately, we've come to the end of our podcast here, but I'm having just such a great time and learning so much, such a unique perspective, and understanding what you guys have been doing in the space. It's just fantastic, and I love it. Thank you so much for your time. I appreciate you, and I appreciate all the good work that you're doing to make speech therapy accessible for all of the Americans.
Thank you very much. Really was enjoyment. Thank you.
Thank you. Have a good one. Bye.
Bye-bye.